The state of Texas is running out of ICU beds, according to data from Johns Hopkins University. ICU beds are at 93% capacity, and most of the beds are taken by COVID patients. Over in Dallas, things have gotten so bad, a doctors group was reportedly weighing the idea of considering a patient's vaccination status, along with other triage factors, to decide who gets a bed. They've since walked back on that idea. And joining us from emergency room physician Dr. Geoffrey Mount Varner, who is no stranger to BNC Live. Always a pleasure to have you, Doc. So let's start from the beginning. The pandemic has been made into this political lightning rod. We see it happening every single day. Now it's a race to figure out, how do we keep this virus from surging? The lieutenant governor of Texas now blaming blacks on surging COVID cases. The Kaiser Family Foundation reporting around 9% of Black Texans are vaccinated, compared to about 38% for whites, 35% for Hispanic. Now, ironically, Governor Abbott, now the lieutenant's boss, blamed illegals on the rise in cases, ordering troopers to pull over vehicles possibly transporting border crossers, who could possibly help fuel the spread of the virus in that state. Is this about containing the virus, or is this about racial profiling? This is a state that is fighting against mask mandates.
Well, first of all, thank you for having me on your show again. But I think that you nailed it in your very last comment. What this is really about, this is about creating a distraction for some poor policies that were not based on science. And so now they've got to come up with another way to have people look a different direction. Because again, it was their policies. They did not follow science. And they are the state that fought mass mandates. But yet when the governor contracted COVID, he had been vaccinated, and he also got the best of care. He received monoclonal antibodies. So I would find it almost laughable at the fact that now they are pointing towards these marginalized groups who probably may not have had as much access to the vaccine in the first place.
Yeah, and they don't make up a larger portion of the population there either. So, Doc, another doctor in Alabama told his unvaccinated patients he will no longer see them starting October 1st. Now, this prompted at least 3 of them to ask about vaccination. Do you see more doctors following in that suit to boost vaccination rates? And would you consider doing that as well, or have you?
That is an excellent question, and I commend that doctor for doing that. And yes, I do believe that you will see more doctors doing that. Within the ER, that's not a policy that I can put into place, but I do find it interesting when I am taking care of an unvaccinated COVID positive patient who's actually not there for his COVID symptoms, but wants maximum and regular care, as they should get, but they don't realize they're putting the rest of the hospital staff at risk. So yes, in answer to your question, I do see many doctors, maybe even clinics, and maybe even some healthcare enterprises actually following suit.
All right, so I know this may be, well, I don't know, but I'm assuming since you're an ER doctor, you see all kinds of stuff coming in and out of there. A Mississippi man hospitalized after he tried to treat his COVID diagnosis with, I don't know, some type of medicine that treats worms in livestock. Apparently, it's popular, never heard of it, among opponents of vaccines and masking. Have you seen anything like this? And why are folks so misinformed when it comes to just, I don't know, getting vaccinated, maybe going to a doctor first before trying to treat their own diagnosis?
Well, you bring up an interesting point. I think people are misinformed because you have this slew of information that's just wrong, and they are following it. And yes, we're seeing patients who come in and they've developing these home remedies when they could have just gotten vaccinated. And then keep in mind that if they contract COVID, we even have free treatment for them called monoclonal antibodies. So in summary, there's absolutely no reason for anyone to develop any home remedies. But the first start is vaccination, prevention, and also making sure you socially distance and do and behave wisely during this COVID crisis.
So, doctor, I have to ask you that antibody treatment, do you recommend that to your patients? Because our resident doctor said that's something that's not offered to Black and brown patients. And I know when I was diagnosed with COVID, I wasn't offered that either.
That's a very good question. And I've not heard about cases where it's being not offered to certain populations. But in the ER, it's usually not given in the ER. Once I test you as positive, then there are sites that you can go and visit that are free, that you can receive this monoclonal antibodies. Now, this is the nuance. Not everyone qualifies for it. You've got to be over the age of 65 or over the age of 55 and have diabetes, high blood pressure, pregnant. There are a number of different factors. But the most important factor, which has changed about 2 weeks ago, is that anyone over the age of 12 who has a BMI, meaning that they are obese, but a BMI greater than 25, you are able to receive monoclonal antibodies. So it's kind of nuanced, meaning that not everyone qualifies, but if you qualify, it's so important that you receive monoclonal antibodies early on in the treatment because they have an 86% success rate.
So talk about that treatment and how it compares to just someone deciding to go home and try to just brave the virus out of them by taking fluids and whatnot.
Well, that is an excellent question. Most people, actually, most healthy people who go home and once they contract the virus, most of them go home and do just fine. But the monoclonal antibodies are uniquely focused for that population that, based upon data, we know you may not do as well. The diabetic, the older folks, pregnant people, people with autoimmune disorders. Our data shows that you may not do as well as obese people who are healthy. So if you fall into that category and you have a COVID positive test, yes, you qualify, and I highly recommend that, therefore, you seek monoclonal antibody treatments. People are going to talk about cost, but it's free. But for those of us who are healthy and you receive a COVID positive test, listen to what your doctor say, because most people go home, they hydrate, take their vitamin C, and follow what the doctor says, and they do just fine.
All right, Dr. Geoffrey, well, we're going to continue this conversation over the break, and anyone that's just joining us right now, we'll continue talking about public safety versus personal freedom when it comes to this pandemic. And after the break, we'll also talk about federal government's push for vaccine boosters and what it might mean for you and when you can expect to receive yours, if you choose to. You're watching BNC Live. We'll be right back. And welcome back to BNC Live. I'm Tashanea Whitlow. Good news in the fight against COVID. More Americans are rolling up their sleeves. That's according to the CDC. Nearly 60% of the population eligible for a shot is now fully vaccinated. It comes as an alarming number of Americans are being hospitalized for it's setting a record, better yet, for people under 50. It's the biggest jump. The biggest jump, better yet, is people 30 to 39 and kids under 18. The CDC says those rates are up more than 30% than the previous peak in early January. All right, back with us to discuss just that and more, we have emergency physician Dr. Geoffrey. Always a pleasure. I want you to listen to some sound from Dr. Anthony Fauci on booster shots first.
We don't want to wait until all of a sudden a lot of people are getting hospitalized and a lot of people are dying. We want to be ahead of it, and we want to be prepared for it. I use the analogy, you want to skate where the puck is going to be, not where the puck is right now.
Nothing like a sports analogy when it comes to a pandemic. Do you believe the decision on booster shots, Dr. Geoffrey, is the right call, especially the timing, the 8 months after your first shot? Is that right?
Yes. After the 8th month, this is an ideal time. And how he phrased it is correct. We don't want to aim to where we are. We want to aim to where we're going to be, where we know we are going to be. And there's sufficient data. In fact, there's very good data out there to support this third booster shot. So I think this is one time where the federal government is hitting that nail on the head just right.
All right, and also looking at the data on the declining efficacy, 8 months, should it be sooner than 8 months? Or that's appropriate? Because I'm hearing I know some people, I won't say any names because they'll call me out, but they haven't reached that 8-month mark, and they're already making appointments to receive their booster shot. Is that safe?
So let me parse this. That's an excellent question, and thank you so much for that. Currently, the recommendation looks like it's going to be 8 months, but there's data out there that says that your antibody load, it slowly declines each month, and therefore it would not be unreasonable for different populations, meaning those who are immunocompromised, those who are older, those who have diabetes, those who have high risk, to get it earlier. But I too, Tashanea, I've heard of people getting it earlier, but that's not the current recommendation. Is it safe? It just depends on your medical profile, but that's currently not the recommendation to get it earlier, although I am also aware of people who are getting it early.
So what type of medical profile do you need? Who falls under that category of needing to have that shot earlier?
Well, it is those people who are immunocompromised. Meaning you have autoimmune disorders, you have cancer, you have you are a transplant patient, you are on immunosuppressant drugs, which therefore give you a more compromised immune system, which therefore means if you contract COVID, you're very likely to have a negative outcome. And that's why your antibody load, the number of antibodies that you have circulating to fight SARS-CoV-2, if you contract it, it needs to be higher than most folks. So that category, it makes sense to give them their shots earlier. And we're not in the space where we're going to run out of shots. This is one time, it looks like we're going to have plenty of shots.
Okay, and Dr. Geoffrey, with cases surging, how is that group? How is that group of people doing? Better yet, the people with the immunocompromised systems, how are they doing?
That is an excellent question. That group of people are they're doing okay, except for one group, those over the age of 65. We have seen a significant increase in vaccinated older people who are now appearing to the ER, needing to be hospitalized, needing to be placed on vents, hence bringing it full circle. Dr. Fauci's recommendation about getting it earlier or starting the booster shots earlier, it makes sense because we are seeing waning antibodies in everyone, but primarily in the older people. And don't forget, there was the older people who were vaccinated first, hence their antibodies are probably lower than most folks.
All right, so tell me a little bit about what about the folks who received the J&J, that one shot, that one and done deal? Where do they fall within all of this?
That is a very interesting question. And fortunately, no one knows the answer to that. I am expecting a press release for them very, very, very soon because they've not submitted or they've not divulged data. It is my sneaky suspicion that they will also develop a booster shot as well. But we just need to see more data. So I would encourage those who received the Johnson & Johnson to hold tight because it's very likely that that data is going to be coming out very, very soon.
All right, Dr. Geoffrey, you've answered enough questions about everyone else. How are you doing? You've been on the front line since this pandemic started. How are you holding up?
I've been on the front lines. I've been holding up well. I make sure I have things to look forward to. And the background you see is me at my daughter's campus because I'm dropping her off as a freshman in college. So it gave me something to look forward to. So these are good times right now.
Congratulations. And I knew that wasn't a white coat. Now I see it's a white polo. I'm like, something is different about Dr. Geoffrey today. Oh, well, congratulations.
You're so right. You're so right.
That is awesome. Congratulations and all the best to her in her upcoming school year. Thank you.